I believe that many of us in this room, if not all, do want to protect the most vulnerable and deserving of health care coverage. But there doesn't seem to be a lot of agreement on exactly who that is. And that's especially true for the larger Republican caucus, because there are people outside of this room who don't even like this because they think it doesn't cut enough people. Based on everything that I have heard in the past 25 hours, there seems to me to be a disdain among some of you for the expansion population. I've heard some, like the chairman, say they're deserving and need to be included. I've heard others that say we need to get back to the original population, which I assume means 1965. But I'm going to give you the benefit of the doubt as a preacher's kid and say, you mean the expansion population. I hear a clear disdain for undocumented immigrants and transgender individuals who have become the boogeyman for the vast majority of Republicans for everything that they think ails this country. But whether we like it or not, they're not the ones that are causing the increases in the Medicaid costs. And they do get sick, and they get injured. And if they get sick enough or injured enough, they're going to show up in the emergency room, and they're going to get treated under federal law. And if they're not insured, the cost of their care is going to be passed on to everybody else, and our health costs will go up. Now, as I've mentioned several times today, the real underlying reason for the vast majority of the increase in costs of Medicaid and healthcare in general are the fact that people are living longer with more complex underlying conditions, and that individuals with chronic conditions and disabilities that have that complex care, those costs are ballooning. And this bill does very little, if anything, to address that. It does very little to address the healthcare workforce shortages that we've talked about, the increase in prescription drug prices and technology costs, and the other things that make it difficult to provide care. It does nothing to address the underlying causes of the maternal and infant mortality crisis, the substance abuse crisis, that making serving those populations challenging, even as the actions of the Trump administration gut the very workforce and programs designed to help address those crises and those problems. This bill does nothing to address the gutting of our public health care workforce and infrastructure or tariffs that increase costs, including health care costs. This bill ignores the environmental and social determinants of health and actively works to roll back problems designed to address them as woke or whatever. It makes assumptions that somebody who earns $300 a week will pay up to $35 because they need to get skin in the game, and ignores the reality that that person also has to pay rent, groceries, transportation costs to get to and from the job that they need to have. And they're going to end up not paying $35 to get primary or preventative care, but they will eventually show up in the emergency room. Democrats have been cut out of this process from day one and then asked to trust that this big, beautiful bill that we had nothing to do with, that we got a framework on Sunday for and the text on Monday, and that we're supposed to trust that it doesn't make mistakes by adopting work requirements that have been shown to not actually work in the states that have done them. Oh, trust us. Trust the same people who sit back as Elon Musk fires people by accident and says, oops, mistakes were made, and laughs about it. Everybody in this room, our view on this bill and healthcare policy is based on our life experiences and what we know. And it's very different, and very different from the vast majority of the people that we represent. So I believe healthcare is a right. Because in the Declaration of Independence, the first word of the rights that we're endowed by our Creator with is life. And you need health care to live. I also believe that lowering the number of uninsured lowers the cost for everybody. I think that's what the American people want. I think that's why they've consistently said, don't repeal the Affordable Care Act. or gut Medicaid or Social Security. I think this bill is going to do all of that, and it's not finished. And that's why you hear us
Young lady's
reflecting
time's
the fears
expired.
of our constituents.
Young lady's time
Listen
has
to them, and I
expired.
yield back.